My name's Sydney. I'm a labor and delivery nurse, and today let's talk about what to expect for a Cervidil induction. So Cervidil is a method of induction that helps to get the cervix ready for labor. So it's almost like a ripening agent for the cervix. So it's especially useful if your cervix is really long and really close, so extremely unfavorable for an induction of labor. It's a prostaglandin vaginal insert, which is basically like a hormone that is used to help ripen the cervix, soften it, and open it a little bit so that you can use other methods of induction like breaking the water, oxytocin, a Foley induction, all of those other kinds of things that will come after. So this is really the number one place to start for an induction of labor if your cervix is extremely unfavorable. So it is a tiny little vaginal insert that comes kind of like on a little shoelace, and it's basically like a tiny little, almost like a tampon. So this part here is the part that has the medication, and what the doctor will do is just with their fingers, they won't use a speculum or anything, but they will kind of wrap the shoelace around it so that it gets tucked in and it won't fall out when you go to the washroom. And then they're going to insert their fingers into your vagina using sterile gloves and a little bit of lubricant. And then they're going to shove it up there kind of as far as they can go, right against the cervix. Especially if your cervix is really far back, this might be pretty uncomfortable, but it only takes a couple seconds for them to place it, and then they leave it there. And you are monitored for between 1 to 2 hours. This varies between physician to physician. And then you can go home. So you will start to feel kind of crampy, uncomfortable, some back pain. This is all normal side effects. Cervidil can be left in for 12 to 24 hours. And you can actually get more than one Cervidil. So I've actually had patients who've had up to 4 Cervidils, which is pretty crazy. I would say most people need about 1 to 2 Cervidils before they can go on to further methods of induction. So Cervidil is taken out at the 12-hour mark, at the 24-hour mark, or anytime before that when you enter into active labor.